Well, I think the bone level tapered implant just gives us more options. I think the BLT implant is unique because of the material it's made out of, the surface characteristics on the implant, and the shape of the implant. So it brings really a unique combination of factors that we've not had before to use in our patients. So it gives us more options. And I think it's important that we have different options, especially from one company, that allow us to have that range of products that we can treat more indications in more patients. Well, I think the bone level taper doesn't change the time of healing too much, but it does allow you those cases where you would normally have to do a bone grafting procedure and then the bone, then the implant. It certainly allows you to skip that step in certain indications. Sometimes I think with all patients you have to really evaluate what's the best treatment for that patient. But if you decide with the patient after a number of options you've examined where you don't want to do bone augmentation, you save all of that process and save months of time if you can put a tapered implant in without the bone graft. So you can save time that way to teeth. But I still think, as a trained periodontist, you have to evaluate each patient very carefully and choose the right implant for that patient. But this gives you another option. And I really think it was clever to use the top half the same as the bone level implant. Now, if you get past 8 millimeters, if you're using like a 10 or 12 millimeter implant, the bottom 4 millimeters is always tapered. So as you increase the length, you're only increasing the top part like a bone level implant. So it doesn't matter what size you use. In fact, the longer ones you use, it's more like a bone level implant. So I think the clinician can take confidence in the fact that you're really using a bone level implant for the majority. And the tapered portion only goes in the more cancellous bone, the less dense bone. And the critical part is more in the cortical top anyway. And we know bone level works fantastically because it has the platform switching feature. So that's in the tapered implant, which is, according to our work, it really sort of revolutionized soft tissue attachment around implants. And so I think the top of the tapered implants with the bone, with the platform shifting mechanism that Straumann has built into their bone level implants is fantastic.